All right, so let's practice some acid-base imbalance questions or numbers. So you can get a little practice, and I'm going to try to do them with you here, so that way um, I kind of go over them. Let's see if it works. This is my first time trying this. So the first question is, the client is post-op from knee surgery and has been receiving morphine 4 milligrams every 2 hours. The nurse noticed that the client is exhibiting a respiratory rate of 8 and is extremely drowsy. Which of the following condition is the patient at risk for? So we know that they have had surgery, possibly anesthesia. Then we load them with narcotics. You kind of have to read the scenario that they're giving you here. And also the respiratory rate is 8. So they're not breathing as fast as they should. So pretty much here we can expect that it's a respiratory issue and also that they are retaining CO2. In which condition do you think that it would be? Well, we can definitely, let me get the marker. We can definitely scratch that one out. We can definitely scratch this one out. So now it's between A and B. Are we looking at acidosis or are we looking at alkalosis? If you are retaining CO2, that is very acidic. So therefore, it's respiratory acidosis. And the only reason why they're retaining CO2 is because they're not breathing at a normal rate. They're breathing 8 due to anesthesia and narcotics. Let's try another one. A client with COPD has the following blood gases: a pH of 7.26, a CO2 of 59, and a CO3 of 42. But it's asking you, is it partially compensated or not compensated? So let's do the arrows. Um, pH, is it down or up? pH is down. It's less than 7.35. Is CO2 up or down? Ah, okay. It's up because it's more than 45. And it's by bicarb less than 22 or higher than 26? Is it up or down? It's definitely up. It's higher than 26. So we have opposite directions here. So we know it's a respiratory issue. Okay. It's not metabolic because look at the pH. No, the arrows are not going down. It has to equal the arrows have to basically go in the same direction as your pH. So we can basically discount every metabolic issue. We know it's respiratory. Now, we also know that it's respiratory acidosis because our pH is less than 7.26. We know we're in an acidotic state. So we can already eliminate this one and we can eliminate this one. The next one is, well, is it compensating or is it not? Who compensates in the respiratory issues? The kidneys. Yes, you got it. The kidneys compensate. And because we're in an acidotic state, the kidneys are going to try to hold on to bicarb to basically retain base. So we know we're compensating here. Okay. Because look at that bicarb. It's high. They're retaining bicarb in order to fix this pH. So you can already eliminate this one. It is partially compensated because your pH is still not normal. Now, let's say I would have given you a normal pH, then yes, you are fully compensated. Okay? All right. Let's look at the other one. A client has the following blood gases: a pH of 7.50, a CO2 of 25, and a CO3 of 19. Let's do the arrows again. pH is up or down? Up. More than 7.45. CO2 up or down? It's down. Less than 35. So we already have some opposite arrows over here. Is my bicarb up or down? Okay, it's down. Well, I already know it's not metabolic because look at the arrows are going in opposite side. Metabolic is not opposite, it's equal. It goes in the same direction. So I know this is a respiratory, sorry about my writing, alkalosis because of my pH. Okay. Respiratory alkalosis because of this pH here. Now I identified it, but it's not asking you to identify it. It's asking you which of the followings could not be the cause of this condition. So now this is an application question because we need to figure out what are the conditions of respiratory alkalosis. Okay, now let's review. Respiratory alkalosis is whenever we blow off too much CO2. CO2 is acidic, so we're blowing it off. We're breathing really fast. We're hyperventilating over here. Okay, so which is not one of the causes here? Well, anxiety makes you hyperventilate. Pain makes you hyperventilate. Fever makes you hyperventilate. So our option is CO2. With CO2, you basically retain CO2 with COPD, excuse me, with COPD, you're retaining CO2. So this could not be the cause of respiratory alkalosis. Okay, don't get tripped up because it's asking you this could not be the cause. Okay, this is a very much application question. Which client is experiencing partially compensated respiratory acidosis? All right, here's how I approach these. I already know it's acidosis. So I know my pH is not going to be normal because it's partially compensated. And I know my pH is going to be low. So automatically, I delete this. Automatically, I delete this one because my pH needs to be less than 7.35 or somewhere around there. So that leaves me B and D. And I also know that because it's respiratory, my pH is going to be less than 7.35, but also my CO2 is going to go on opposite sides, opposite direction, so it's going to be higher than 45. Well, this one is higher than 45 and this one is higher than 45. Okay, well that doesn't give it to me yet. I can't tell which is the answer just yet. Now, who compensates? The kidneys. Okay? The kidneys compensate by holding on to bicarb. Okay. And so if I am holding on to bicarb, my CO3 has to be greater than 26 because I am holding bicarb to neutralize this acidic state. So therefore, there we go. It's B because look at my CO3 here. It's 23. Okay, so the answer is B. Okay, let's look at this one. On admission, a client is diagnosed with compensated metabolic acidosis. During the assessment, what is the nurse most likely to identify? Metabolic acidosis. Who's compensating on the metabolic acidosis state? The lungs. Do we want to hyperventilate or do we want to hypoventilate on an acidotic state? Yes, we want to hyperventilate. We want to get rid of this CO2. So here is your deep, rapid Kussmaul's breathings. In metabolic acidosis, we have Kussmaul's breathing is that deep, rapid respirations. Okay, one more. A nurse is caring for a client with infectious diarrhea from food poisoning. The client is most at risk for developing which acid-base disorder? Where do we have, I'm sorry, that was not the question. What do we have bicarb or do we have acid in our stool, in our GI tract? You remember from the lecture? All right, we have a lot of base in our intestinal secretions are very high in bicarb. So whenever we're losing diarrhea, basically this turns into a metabolic state. Excuse me, metabolic acidosis state. So for sure, if it's diarrhea, we're not dealing with respiratory issues here. And then because you're losing bicarb, which is alkaline, it puts you in a acidotic state. Okay, so the answer is A. And then last, a nurse is caring for a client with an NG tube that is attached to low suction. The nurse monitors the client for which acid-base disorder? What do we have in our stomach? Let's recall the lecture. We have gastric juices. We got gastric fluid. Gastric juices are very acidic. That's what gives you that reflux, that a lot of patients experience, that the food sort of, excuse me, my throat gets dry, that it basically gives you reflux and this burning sensation. Okay, well, because we have very acidic gastric juices and we're being suctioned by an NG tube, then we know it's not going to be a respiratory issue. We can eliminate those two. So then we're losing acid. So therefore, you're going to be in an alkaline state. So this is a metabolic alkalosis state. Okay, alkalosis. Okay, I hope this review was helpful and there's more in your resources, but just wanted to make a video working them with you. See you in the next video. Bye-bye.